Welcome. Life offers many gifts. We're better able to appreciate those gifts and serve others when we enjoy vibrant health. At Sharing Health from the Heart, we're dedicated to bringing you information about simple and natural ways to improve health. We thank Bob Beck for his work in bringing us the use of electricity for health and a 4-part program for health, the Beck Protocol. I'm Carol Punt. I introduce you now to Dr. Eliezer Ben-Joseph, a naturopathic physician with extensive use of the Beck Protocol. Let's join Eliezer Ben-Joseph and an audience of 3 who ask questions about the Beck Protocol, a program for health.
I want to thank you for joining us because obviously looking at this tape, you are in the process of deciding to take care of your own health. I want to set the stage a little bit about the difference between natural health care and allopathic health care. Allopathic is traditional medicine, what you all are familiar with, going to the doctor. They treat symptoms. And if the symptom is gone, then by proxy you're healthy. Where naturopathic or natural health care, we look at health and disease as a process, something that takes your entire life to either produce disease or produce health. So we in natural health care don't look at how to eliminate or avoid disease. We look at what are the processes to promote health. And we've broken that down into a number of steps. Number 1 is getting rid of all the negative emotions. Are you living in a state of fear, anxiety, depression? We now know that negative emotions are immunosuppressive and will affect your body, the state of your own health, greatly. We also know that we want you to eat healthy. That's the second one. Stop polluting your body with such what we call the SAD diet, the standard American diet, junk food diet. Start eating healthy, natural foods. Also, a little exercise would be important as number 3. And number 4, actually getting rid of the things in your environment that may be causing a toxic buildup. Are you living in a house with new carpets, with walls that are producing formaldehydes, fumes that you're having to breathe? Are you living in an area where there's tremendous pollution? So these are things to take into consideration. Now I've added one more. I think one of the things that really promotes health is having social commentary, being of service to the community. And I think that's as important as eating healthy or even as exercise. So what I'm talking about is this investment in a lifestyle is what really will bring about a state of health. Now, there are some unique tools that we are now able to utilize to help in this process. Bob Beck has created 3 pieces of equipment, an electrification of the blood, a magnetic pulse generator, and an ozonator for water. These are some of the new pieces of equipment that we can use that will actually help us in this state. Now, back in 1991, Albert Einstein Medical College in New York City presented at a symposium something that was revolutionary. They used microcurrents of electricity to deactivate and neutralize the HIV virus. They presented this at a symposium. After the symposium was over, nothing has ever been talked about it again since 1991, other than the patent on this microelectric current being used to deactivate viruses, not just the AIDS virus or the HIV virus, but any virus. So it's a little kind of disconcerting that something so revolutionary that might change the very course of disease process in the world is not being researched or even being talked about. In discussing the Beck machines, let me stop the camera a minute, take my coat off, and show you what the first machine looks like, the electrification of the blood. Well, as you can see, this is the Bob Beck unit, the electrification of the blood. Very simple to operate. Wear it on your wrist. The electrodes go on your ulnar and radial pulse. On and off switch. Very easy to use, very comfortable. Let me explain a little though about this kind of electricity. This is a very safe, controlled electricity that's been the same kind of electricity that the FDA has already approved for numerous devices that exist, such as the TENS unit, cranial electrical stimulation, muscle stimulators. So there's no danger from this type of electricity.
Okay, you say there's no danger, but I've actually heard that electricity can be harmful. So what is the difference between this electricity and harmful electricity?
You know, that's a good question, because there is a difference between this kind of microampere currents and the electricity that you get from, say, power lines, the power generators. That type of electricity is 60 hertz or 60 cycles per second at extremely high voltage and extremely high amperage, where this unit is only 27 to 31 volts, it's 4 hertz, and micro amperes. And the microamperes, the microelectric currents, is very different than the high ampere currents. Very safe. Any other questions?
Yes, Dr. Eliza, I had a question. If I would like to build the unit, the blood electrification unit myself, how difficult would it be?
Well, you can get the schematics from Sharing Health at the website. I believe it's www.sharinghealth.com, and they do print and put the schematics there, and you can build it. You do have to have a little technical skill. Let me mention a little about understanding the electric nature of the body and why we use a machine like this. First, we know that all of the cells of our body are small little electrical generators, electrical units. Dr. Bob Becker, in the book Body Electric, talks about this. There's all kinds of books now that talk about the electric nature of the body, and that there are these little electric microcurrents on a cellular level. So what we are using is these same kind of microelectric currents to actually bring about a state of health. We're actually re-electrifying our body. Let me talk a little about the protocols for blood electrification. Dr. Beck calls for about 2 hours per treatment for about 4 weeks. Now, I suggest that you want to build up slowly. I know some of you maybe jump in with both feet and do it for 2 hours the first day, but you might want to build 15 minutes per day, 3 or 4 days, adding 15 minutes until you get to that 2-hour period, and then do it for 4 weeks. You want to make sure that while you're doing the protocol that the elimination systems are all open. Remember, there's only so many ways you can get rid of garbage in the body, and actually there are 5 ways. You can poop out all the stuff, the garbage, you can pee it out, you can sweat it out your skin, cough it out of your mouth, or blow it out of your nose. But that's the only way everything is going to come out. So make sure these elimination systems are open. Also, I think building up is important. Now, why do we do it for 2 hours at a time? It takes about 8 to 9.5 minutes to get total blood volume. That means as the blood is passing the electrodes, it takes about 8 to 9 minutes, 9.5, for that blood to make a complete circuit in my body and come back. So if we do it for 2 hours, you're really getting 12, almost 12 complete circuits of the blood, so that you can deactivate the pathogens in the system, microbes and viruses and molds and funguses. So it takes that amount of time. Any more questions?
Yes, Dr. Eli. Is there a particular time of day that's important to be doing a blood electrification program?
That's a good question. And you know the best time of day? The time that you'll use it. Now, yes, we can talk about it. Is it easier in the morning or easier in the afternoon? Or some people, because it's so convenient and portable, you might even take it to work with you. Okay? It's easy to use. But the time of day, I suggest to my clients and patients in the evening, where they can sit down and really pay attention to what they're doing. And you can sit maybe in a nice room, maybe a little meditation or listening to some music, but doing something consciously. You know that you're working on your health. So I like to work on my health consciously.
Yes, you mentioned 2 hours. Let's say if I wanted to put a lot of work into making myself healthier, and I want to do, let's say, 4 hours. Is that going to cause any harm to myself?
Now that's also a good question. Now let me explain. One of the differences between natural health and allopathic health is that we don't deal with specific diseases. What this unit is doing is promoting health. So it really depends on what you're using. What is the intent of the use of the machine? Are you trying to get rid of symptoms from some disease? Do you have cancer, hepatitis, some kind of disease? Or are you healthy and just want to promote even more health? So how you use the machine is really through your own knowledge of what your intent is. But I think if your symptoms are gone and you're feeling well, I think using the machine once you're feeling very well, once or twice a week, or maybe 1 week out of a month, or maybe doing the 4-week protocols once or twice a year. It really depends upon you. Because remember, when we're talking natural health care, what we're talking about is a process. Well, you eat and you're exposed to things all the time, so what's happening in that health process is how you'll determine to use the machine. Any other questions?
Yeah, I have a question. When would you know when to stop? You mentioned a minimum of 4 weeks, but I've actually heard that some people go longer.
One of the ways that you can tell that you're finished, I use live cell analysis in my practice, dark field phase contrast live blood analysis. So we look at the blood under a microscope. Oh, and the blood is just a wonderful picture of what's going on inside your body. You can see the shapes and sizes of the blood. You can see the garbage and debris that's floating around. And you may see all the debris from the deactivation of these pathogens by the electrification of the blood machine. So when you see that in your blood, even though you may feel better, you may want to continue a little more. Now, it's very important that you drink water and you keep the elimination systems open while you're using this machine because of that Herxheimer reaction. Remember, the Herxheimer is that medical term for the die-off and the elimination of all this debris. So it's very important that you're drinking enough water. Now, what do I mean by drinking enough water? However much you weigh, you take half of that and you drink it in ounces every day. So that's half your body weight in ounces every day. Now, when you're using this unit, I suggest drinking a large glass of water, maybe an hour before the unit, and again a half an hour before the unit. And ideally, you would want to drink a glass of the ozonated water, which we will show that machine a little bit later. So you also might want to be careful when you stop. You know, if you've been using this machine for about 4 weeks, it does improve the oxygenation of the blood. It does improve the immune system. So stopping too suddenly may be a little jolt to the body. So the same way you gradually built up, you may gradually lower the amount of time that you're using the machine. But while you're doing that, your other lifestyle habits do not want to slide. You want to continue eating healthy, you want to take the nutrients, and you want to continue drinking water. You can also know when you're done. Maybe get a blood test if you were doing something specific because you had a blood chemistry, as an example, and you saw something that was off, and you get a new blood chemistry and you find that those chemistries are all back to normal. That might be another indication. But the best indication is still how you feel and what you want out of your own health and your own intention. Any other questions?
Yes, Doctor, I was wondering, is it safe to use this unit on children?
Now that's a good question. I have used this unit on children. There is no FDA rules and regulations on these units. And in natural health care, what we're looking at is the intention of the parents. So when you're talking about children, it's really up to the parents. I believe that the authority is in the parents to decide what their children need and not in the state. So that's a little political commentary, but I really believe that the parents determine what is best for their children.
I was wondering, would I repeat this process more than once, like say for health maintenance?
That's another good question. It kind of ties in what we've been talking about. Again, it's your intention. What do you want out of your own health? Remember, health is a process. Disease is a process. You are living daily. You are maybe exposed to pollutants on a daily level, a daily basis. So depending upon what you want from your own self is how often you use the machine. I personally am very healthy, but I like to use the machine once a week. I'm sitting in front of the TV, like to play with the machine and use it. But if I felt, as an example, during the flu season when all of my clients and patients are coming in and everybody's sick, I might use it every other day, even 2 times, 3 times a week. But again, it's up to you. There are maintenance programs. Once you're healthy again, were you doing it because you were healthy and you want to just improve your own health or stay healthy? Is it preventive medicine? Or are you trying to get rid of some symptomology? And again, what's unique about this machine is that we don't deal with specific diseases. What we are doing is promoting health.
Yes, I was wondering, are there any dietary restrictions to consider when using this unit?
There are certain things that you do want to stay away from. I suggest not doing drugs. I suggest not drinking coffee or highly caffeinated teas or prescription medications, even synthetic vitamins and minerals. You want to be careful about. Now, Dr. Beck also talks about garlic, and that there's been some research, I know in Indian Ayurvedic medicine, they call garlic a tamasic food. It's a very reactive food. Now, minor amounts, again, garlic is a spice. It's not a food that you sit down and eat a plate of garlic. So if you were just using a little teeny bit as a spice for your foods, it probably would be okay. But if you're eating a lot of garlic to lower cholesterol or get your platelets to be thinner, I would suggest not doing garlic. Another thing, no alcohol, please. No alcohol, no recreational drugs, no smoking. There is a condition called electroporation, and electroporation causes the cells, the pores of the cells to become more semi-permeable. The pores are not more permeable, but the receptor sites are more active, so it picks up more. Well, if you have the antioxidants from good, natural, healthy vitamins, then those receptor sites are filled with good, healthy cells, and they won't pick up some of these other compounds. Again, excellent question.
Yeah, I actually have a comment. One time when I was doing my blood electrification unit, I did a little experiment. I decided to drink a cup of coffee while I actually had the unit going, just to see what it would do. And I didn't have any reaction from it whatsoever. I drank my cup of coffee. I only had about 20 minutes left on it, but I didn't get any reaction. But then there was another time where I took vitamin C just before, and I actually did get a reaction the next day from it.
We believe that this is very safe, but we do want to talk about the risks. So there may be this risk. That's why we suggest no alcohol, no coffee, no drugs. Really, it's better. Again, the intention. So if your intention is to promote health and you're drinking coffee and taking drugs and alcohol and you're still using the machine, there might be a little paradox going on here. Okay? And I don't mean 2 doctors. So, other questions?
Yes, Eliezer, I understand that after using the unit for some time that often there's a rash or an irritation can appear. Why is that, and can you tell me a little bit about it?
With that little rash, you can use an electrolyte gel or even not even use the salt in the solution, just use plain water. You just want to barely feel the electricity. And sometimes after a while, because your skin gets used to it, you might not even feel the electric current whatsoever. But I really like the electrolyte gel. That does kind of spread the electricity out in a smooth manner and doesn't cause the rash at all.
When I'm doing a blood electrification program and I'm looking for my pulse points, I have no problem at all by my thumb. But for some reason, over by my little finger, I seem to have some difficulty. Is there anything that you could suggest to make it easier to find?
Yes, actually there is. The radial pulse is by your first finger and your thumb, and the ulnar pulse by the little finger. And what you want to look at is that the hollow, you're not looking at the vein, you're not looking at the little blue vein that you're seeing. There's a very soft, hollow indentation right very close to your little finger, the line of your little finger. And you can feel it in there, and just by pressing, it's a softer tissue. The same on the radial side. You'll see right next to those tendons and the outside of the radial bone, you'll feel it's a soft tissue, and you can almost press in, and then when you press in, you do feel the pulse there. So you just have to be, a couple times. Once you've done it once or twice, you'll really get that. I think it's pretty easy once you've felt it.
And another idea may be just to get the blood pumping by taking a brisk walk around the block, or maybe up and down the stairs, quick run.
Yes, that'll certainly get the circulation going. The other thing you can do is just get a tourniquet, a little one, put it on the arm, or put like a little tennis ball just underneath your armpit and hold it tight for a moment, a mere moment, and you'll feel the pulse. It'll kind of stick out.
Yes, doctor, I was wondering, if I can't feel the current once the unit's on my wrist, how would I know if, say, the unit wasn't working, or perhaps even if it was the cords themselves? How would I test that?
One of the things that I would say most men and young boys know in the entire world is we used to take these little 9-volt batteries and we'd touch them to our tongue and we'd get that little shock. Now most women don't know about this, but you can take these electrodes, actually just barely turn the unit on and put one on each side of your tongue, and you will feel a little teeny electrical current. Make sure the unit is not turned up all the way when you test it, okay?
Actually, I have a comment on a bit of research I did on myself, and then I have a question. You mentioned about touching the probe cords to your tongue to test it. I had an awful toothache, and it was very, very painful. And so what I did is I took the probe cords, made sure the cotton sleeves were wet. I put one on each side of my gum, and of course I turned it up very slowly, just onto the on position. Now in about 35-40 seconds, the pain went away, and I thought, wow, this is great. But about 25 minutes, 30 minutes later, it came back with a vengeance, actually. And so I kept playing with it back and forth for as long as I could take the current, because it was a very uncomfortable feeling, to have the cords in my mouth. It felt very weird, actually. But what I found is that I got up to a half hour in that evening. Next 2 days, I did a half hour in the morning, half hour at night, and it was completely gone. And I didn't have a problem since. So what I want to know, obviously I lived through that, I'm sitting here in that. So what I want to know is if I want to try with my thyroid, or if I had a problem with a bladder, or an organ on my body, am I going to be causing any kind of problem by experimenting with the probe cords on other areas?
Let me cover that in two parts. First, what you are doing to the tooth. Remember, electricity deactivates bacteria, microbes, funguses, and viruses. So by putting it directly on the gum and next to the tooth, you are probably deactivating the bacteria in the infection of the tooth. Almost the same as an antibiotic. So that was actually quite smart. I think it was a good experimentation that you did for yourself. Putting it on other areas of the body. Now, Dr. Beck talks about using it on the pulse areas of the body, because what you're doing is electrificating the blood. That's what you want. But again, because there are no rules and regulations, if you want to experiment, I don't think it would harm. These are microcurrents of electricity, and the most important, it's microamperage, so there's very little harm that you can do to tissues of the body, even turned up all the way.
May I ask the manufacturer of the unit you're wearing?
I think because of the political climate we live in, it would be best not to really mention a manufacturer. There are manufacturers, you can go on the web, you can look, but I think it would be best not to mention the manufacturer.
Have these units ever been known to cure specific diseases, for instance, like diabetes or cancer?
Now that's a good question, and I want to explain this correctly so that you understand. In natural health care, what we are doing is promoting health. We are not going after a specific symptom or a specific disease. That is the difference between what we're doing in natural health care and allopathic medicine. Allopathic says, I want to cure this disease. I want to cure these symptoms. But in lifestyle changes, what you want to do is promote health, and this is promoting health. So by eating healthy, by exercising, by emotional processing, by doing the things in your lifestyle and then making the choice to use the Beck protocols, you're promoting health, not going after a specific symptom. Other questions?
To your knowledge, is there anyone that shouldn't be doing the blood electrification program? Again,
because of the laws and the non-regulatory effect, there are no regulations on the machine. It's up to you. Now, I believe that pregnant women really shouldn't be doing anything different. I don't even like pregnant women to make big changes in their diet. I think a nursing mother, again, shouldn't be doing it. If you have a pacemaker, the research out there has shown, and actually in contacting the pacemaker company, this is such small microelectric current that it's probably okay, but we're not sure. Use your discretion. It's up to you and your own experimentation with it. There is enough research on this type of microelectric current from the FDA, and that they have not evaluated this machine per se, but the microelectric currents have been evaluated and are in continuous use, so that should be okay. Because there are no rules and regulations right now, there is one manufacturer, though, is attempting to get FDA approval. The problem with that may be, though, that once we are FDA approved, or the machines are FDA approved, it may then be limited in who can get it. You may have to have a prescription to get it. So there is something about the public domain right now that is beneficial in the natural health care. The research is clear that these microelectric currents are beneficial and so far harmless, that there are enough units on the market today, TENS units again that I mentioned, cranial electrical stimulators, and they have been used for many, many years, showing no harm. I like the fact that it's available in the public domain, so that anybody that wants to promote their own health, that it can be utilized. Another important factor to understand is that according to the law right now, every person is allowed to experiment on themselves, that you can buy a unit and use it for your own experimentation purposes. Once it's a prescription, that might change things. So again, in the public domain, using your motivation to promote health, being able to take a machine and experiment on your own, that's one of the ways that we are able to utilize the equipment and keep it in the public domain. To sum up, what we are doing is we're using the electrification of the blood with the Bob Beck machine, and we're using it to enhance the immune system. There are new studies that came out of Europe and Scandinavia that actually show that white blood cells use electricity to deactivate microbes, funguses. So what we are doing is duplicating and enhancing what the immune system is already using. Now, there are other tissues in the body other than the blood where we still want these microcurrents, and that's where we're going to lead into and talk about the magnetic pulsar to get those same microcurrents into the lymph and interstitial fluids and other tissues of the body. Hi and welcome. We're going to demo the electrification of the blood unit. Here you can see right now a couple of home units. You can see this one. This still needs to have the cotton that is going to be wrapped around. You can't really adjust these, the placement of these electrodes as well, but you can see this is a home unit and it probably works fine. This is another unit. The cotton has already been put around the electrodes. You can see it's just a simple home with the electrical tape and the strap and everything else. You can see all of these pieces of equipment are readily available at some place like Radio Shack. First thing, you take the strap, and it was built in with a little holder. So we take and we put the holder in, and if you notice, I'm putting it, just about so we can see the lights. The Velcro is at the top, okay, and you just put it on, as you can see. And oftentimes, you know, it's nice to have someone to help to hold it, but if you notice, it was very easily done. I'm able to do it myself. You can then actually test it to see that it's working, turn the switch on, and as you can see, the light is on, and we now know that the machine is working. So we close it off. I then take one of the wrist straps, and again, it has a cloth end at one side and a kind of a neoprene on the other. I put the neoprene down to my wrist and attach. Very simple. I make it just snug enough. Now, what I want to do is get these just wet enough, but at the same time not dripping. And I put the sleeve all the way down on the electrode. So now the whole thing is damp, but it's not soaking, okay? And I slide the sleeve in, the electrode underneath, and I want to make sure that just a little piece of the cotton sleeve is showing. This way I'm able to take the eyedropper, and then depending upon how long I use the unit, I can keep a couple little drops all the time so that the sleeve stays wet. Then same thing, and what's nice is the little hole where you slide the electrode in. You take a little and just put some and get it wet. Let it get in. Then we take the electrode, place the sleeve on, and notice that I'm able to do this alone. I mean, it's nice when you have a wife or a mate or somebody with you to help that can hold it, but it is designed so that you can do it alone. I slide the other one in, and again, just enough sticking out, and I make sure it's placed, and I have done this enough so that I know that it's placed correctly. Then I come in and maybe put just another, because it's already wet, it'll take the water a little bit better. And I put another couple, 2, maybe 3 drops. And you can see now what I've done. Again, you can see how I've placed the unit. It's very simple. I have just enough showing so that I'll be able to keep it moist. We've tested the unit. We know it works. I now plug it in. And again, if you want to get some of these other wires out of the way, I'll show you that you can use the second strap. So now you can see it's quite comfortable. It's out of the way. I'm able to use the unit. We have it plugged in, and now we turn it on. And again, notice that there's no light when I turn the unit on. And the reason is, and this is again an innovation from the company, it's so that they don't run the battery down. We don't need to see the lights to know that it's working. We can feel it now. You turn it up, you can see my hand, and you can get a nice current. I'm turning it up strong enough so that you can really feel it. But if you see, my hand is just automatic. It's not uncomfortable. You'll feel a little tingle, and as you get used to it, you'll find that it's a little less. If you don't want it so strong, again, you turn it down just enough. I'm able to go about my business. I'm able to work. And again, if you're not sure and you're not feeling it even though you turn it up, then get a little plain salt and put like a 3-finger pinch right into the water. Let it dissolve, stir it up. Now you have a much greater conductor of electricity. Again, you can also, if you have access to a medical supply, just buy the electrolyte gel. Very simple, easy to use, the first part of your 4-part protocol. Well, let's move on to the magnetic pulsar, another tool by Dr. Bob Beck to help promote our own health. And a magnetic pulsar is something unique. It's a direct current, time-variant, pulsed magnetic field. It's been used for many, many years, and what the magnetic field does is it goes after the lymph system, or lymph nodes, or other tissues of the body where other pathogens, molds, funguses, yeasts, viruses, may be hiding out. Now, we use the electrification of the blood to get the pathogens that were in the blood. But oftentimes it is the lymph nodes that become swollen and just full of a toxic load of pathogens. Now, what we want is to create this same type of microelectric current in those lymph nodes or in the lymph cells and in other tissues of the body. Now, how you do that, and this is standard laws of physics, we know that all of our cells have water in them, and there's fluids. And when you direct a magnetic pulse to anywhere that there's fluids with minerals and electrolytes in those fluids, you generate small microelectric currents. So by using the magnetic pulsar and pulsing directly onto various tissues, organs, or lymph nodes, you are actually creating these same microelectric currents, but on a cellular level. You're actually making these currents flow. Now, what do we know? Electrical current are electrons. You've all heard the term free radical. But what is a free radical? A free radical is any chemical minus an electron. So by developing these microelectric currents on a cellular level to get a free flow of electrons, you're actually negating free radical damage. You're actually helping to stop the free radical damage by giving electrons and making those electrons really flow on a cellular level. So again, what we are able to do is deactivate those microbes and viruses and funguses. We don't kill them, it deactivates or neutralizes the receptor site. So now what happens, they're expelled into the bloodstream and the body is able to get rid of it. Now, one of the differences between a pulsed magnetic field and what everybody in the health field is using, which is static magnets, there's a dozen companies now selling magnets that you place on various areas and wear in your shoes, or you have a bed, with the mattress pads, but they're very different. One is a static field and one is a pulsed magnetic field. Now, in the laws of physics, what we know is when you pulse that magnetic field directly on a cell that has these electrolytes inside the cell, then you are producing microelectric currents. So static magnetism doesn't do that. Static magnetism, we know, helps to increase oxygen and increase circulation, but it doesn't increase these microelectric currents, and that's what deactivates the microbes and funguses and all the pathogens. So very, very important to understand that difference. And I'm not saying not to use the static. The static can also be part of a health program. I personally wear the ones in my shoes, and we have one of the magnets on the bed. But nothing takes the place of the magnetic pulsar so that you can go directly at a tissue that needs to be addressed. Once there's inflammation, there's congestion. Again, this congestion of fluids. And by pulsing this magnetic field, you get these fluids on a cellular level to actually start to move more, and that's how the body then is able to clear it from the system. Another thing that Dr. Beck has given us, again, is the schematics, how to make your own unit. You can go to where I mentioned before, sharinghealth.com. That's www.sharinghealth.com. You can get the schematics and learn how to make it. But again, it does take some technical skill. I recommend buying a unit that is endorsed by Dr. Bob Beck. Very important is drink a lot of water. Now, I suggest using, as Dr. Beck suggests, to use the protocol, the magnetic pulsar, before the electrification of the blood. So when you're going to do it, make sure about 30, 45 minutes, maybe even an hour, drink a large glass of water, then maybe again at a half an hour before you use the machine, drink another large glass of water. This really cuts the Herxheimer effect, this die-off. Then, when you use the machine, you might start even 5 minutes, 10 minutes, 20 minutes before the electrification of the blood, and use it on specific areas. Again, you build up slowly. I suggest 5-10 minutes at a time, maybe every 3 or 4 days. Build up another 5-10 minutes until you're doing 20 minutes, a half an hour, even an hour before the electrification of the blood. Any questions then?
Yes, I've heard that it's best to use the units together. But let's say, for example, I had a specific problem, like maybe a sprained ankle. Can I just use the magnetic pulsar on its own, or would I have to do the whole protocol?
Good question. Now, what's unique about the Beck protocols is that any of the units can be used singularly. Any unit can be used on its own. We always suggest if you're going after a health condition, if you're going after some disease process, again, we're using these units to promote health. But if you're doing it to help and get rid of these symptoms of a disease process, then you use all the units together. But like you say, if you have a specific inflammatory response, a sprained ankle, a swollen knee, an arthritic joint in your finger, or a sore throat, or anything like that, the machine can be used alone. The only thing you want to remember is that whenever you use the units, make sure you're drinking a lot of water. I can't stress that enough. And remember, that's half your body weight in ounces per day. But when you use the unit, you're going to add a little bit of extra water before you use the machine. If you're drinking coffee, you got to add more water. If you're drinking soda pop, you have to add more water. But I suggest, again, as we talked about in some of the earlier protocol, not to be doing those kinds of negative foods, part of the SAD diet, standard American diet, junk food. Cut those out while you're doing this. Remember, it's intention. What is the intent of why you're doing this? What are you trying to promote? Your own health? Then you have to do all aspects of your lifestyle.
Yes, I was wondering with the magnetic pulsar, is there any areas of the body that I should be avoiding? Most
of the areas can be utilized. Now, let me say, if you have a pacemaker, do not use it near the pacemaker. There's a few other areas that I have found over my experience. As an example, when we have been treating individuals that had prostate cancer, you do have to be careful about pulsing around the testicle, because it does cause fairly severe, when gentlemen, and it's happened a number of times, pulse too often around the testicles, that they were in pain afterwards. So you do have to be careful. I also suggest maybe not pulsing directly into the eye, especially if you have some kind of implant from a physician because of a cataract. So as a normal precaution, just because we want to give you the risks that may come with the unit, we suggest not pulsing a direct open wound, or specifically if you're on Coumadin, check with your physician, check with your natural health care provider. Other questions?
How would it work in the teeth area? Say, for instance, on a toothache.
We know that magnetic pulsing will work on any tissue of the body. Now, some people, it's actually helped to alleviate the tooth pain, and some people, maybe not. Again, it depends upon the sensitivity, your own biochemical individuality. But also, it might even depend on how many fillings that you have in your mouth. We don't want to produce too much electricity in the mouth where there's metal fillings, because anytime you produce electricity around metal, you disassociate the ions of that metal, and you may have mercury that is released. Again, we want to cover all the risks. It's only fair to you, the consumer, that may want to use these, just to know the potential risks. And again, we're not saying that that's what's going to happen.
So what about braces?
Another aspect of the magnetic pulsar, especially when you're doing the teeth, is that when you pulse, this magnetic pulsar with 40,000+ Gauss of magnetism will penetrate about 9 inches through human tissue. Most of the braces, or even most of the pins that people have inside their body, are non-ferrous metals. So they shouldn't really react with the magnetic pulse. But again, be careful, use your own judgment, start slowly. I don't think that you're going to have a problem, though. Good. Those are good questions. I want to thank you for that. You helped stimulate me for these good dialogue. But other questions?
Yes, Doctor, I was wondering, how would I know if the pulse is actually being released, that the unit is actually working?
If you hold the unit up next to your ear, you'll hear a little click each time it pulses. And you'll see that on the unit there's some little green lights. You can usually tell, and you can hear the click, or get a little metal washer and put it on, and you'll see that the metal washer moves when it clicks. Good question again. Thank you. Other questions?
Yes, doctor. I was wondering if it's possible to use the magnetic pulsar on children.
Now again, there are no laws on these units, so right now it's up to the parent. Now we have used it, in my practice I've used it on children, and again, I don't actually use it. What I do is make it available so that a client can buy it themselves and take an active role in their own health care. So there are a lot of physicians that may have a unit and want to use it as a treatment protocol. I really like people to take their own active role. So I make these units available, show them how to use it, let them take it home and use it for their own family to promote their own health care. I don't want to use it necessarily as a medical device in a practice, because again, I want to keep it in the public domain, and that to me is very important. Now, along with children and using your own judgment, I think that, again, you have to be careful. If you're a pregnant woman, I would be careful using a unit. If you're a lactating, nursing mother, I would be careful using a unit like this. Use your own judgment. The company that I like to buy from that is they're taking an active, proactive role in helping to make these pieces of equipment available to the general public. And at the same time, to foster research for the medical community. And welcome back. The next demonstration that we are going to do as part of the fourth part of Bob Beck Protocol is the magnetic pulsar. Here's our magnetic pulsar on the wand, and you can see that it is marked magnetic north. Now, understand that magnetic north seeks south, and magnetic south seeks north. Remember, opposites attract in magnetism. So our north pole seeks the south pole. And this is a home unit, and it's one of these home units. You can see that here it's well made. Again, it's made with the flash attachments, the photo flash that Dr. Beck talks about. You can hold this unit to your body again and push the button, you hear the little click, you saw the little light go, and these units again are fine and functional. A little difficult to make, but it is, if you have that technical skill, you can do that. I again like to use units that are manufactured, endorsed by Bob Beck. I think it's phenomenal, ease of use. Now you can see that we turn it on. And what we're going to do is test. You can test the polarity of the unit, and one of the ways, this is the North Pole, and what you can do is take again as a compass, and the compass should point north, and because of this is North Pole, so the compass that points to the north on the Earth should point to the north here also. Now, I want to show you the degree of penetration here, and you can see that the lights are moving, and as it comes across, when it reaches that last one is when it pulses. So what we're getting again is this movement, a pulsed time-variant magnetic field. This is nothing more than a coil of wire. And you can see that there's no electricity on this coil. It's just a wound up copper wire. Here at the end is an LED light. It has some circuitry so that we don't blow up and blow the light. But I want to show you the penetration and also how magnetism creates electricity. It's the movement of magnetism that creates the electricity and the penetration. So here you can see, I will put the unit up next to my neck, and I'm going to just take this wound coil wire, and I'm going to hold it at the other side of my neck, and you can see the little wire, and you'll see the little light kind of blast, and each time it goes through. So you can see there is no current here. What is creating the current is the movement of the magnetic field, which induces an electrical current, and the light will shine. The same way that the human tissue that has water and electrolytes in it, that when you take this in magnetic field and it time variant pulsed magnetic field going through my skin and through the tissues of my neck. The same electrical current that was induced in this wire, that same electrical current is being induced in the various tissues that the magnetic field is going through. So just by holding it here, it's totally comfortable. You don't feel anything. You don't feel magnetism. So I can use it here along with any of my lymph nodes. It goes about 9 inches. And let me show you as an example. Here I showed you just straight, and you can see it's going all the way through, but look how I can even hold it away from my neck. There will be a point where if I go just far enough that the magnetism doesn't reach it any longer. But you can see that this magnetic field does penetrate quite far, about 9 inches. So it is phenomenal. You'll really be able to experience profound healings with this. Now this can be used again, armpit, any of the lymph nodes, tissues, any of the tissues of the body without harm. The machine will work approximately 5 to 10 minutes. You'll see at the end, the LED light came on, so you can see that that has now gone through its cycle. And you then turn off the machine, and if it feels a little warm, let it sit for 2 or 3 minutes before you turn the machine off, and you'll go through another cycle. So each time you can use it, again, any of the tissues of the body. I suggest using it before the electrification of the blood, unless you're using it by itself for dealing with an inflammatory response in a specific area. So again, this is the next protocol in the 4-part Bob Beck Protocol. Great machine to add to your repertoire to induce health and actually promote your own health. Now the next section of the 4-stage protocol is colloidal silver. Ionic colloidal silver. That means very small particle size, electrically charged, that stays in suspension forever. Now, silver has been in use for many, many years. As a matter of fact, before 1938, it was the antibiotic of choice throughout the entire world. Everybody used colloidal silver. Now, you've all heard of stories, as an example, from the farmers in the Old West and the settlers as they were coming across the Old West. Well, one of the things they used to do is they used to put a silver dollar into the milk bucket when they milked old Bessie the cow and got their milk. And it would keep the milk from spoiling. So silver has a very long history of use. Now, still today, there's a lot of silver compounds that are being used. You've all heard of silver nitrate as an example that is put into babies' eyes. Silver nitrate is what gave colloidal silver such a bad name. There is a condition that can occur called ageria, where you get this blue-grayish color to the skin that only occurs with silver compounds. And that means silver with some other kind of chemical. And that is what causes the discoloration. Pure ionic colloidal silver in distilled water will never cause a discoloration of the skin or ageria. By drinking colloidal silver, what you're actually doing is using nature's antibiotic. And what you're doing by saturating and taking in, which is in essence a micro mineral, it's like any other kind of mineral, trace mineral that you're taking in, the body uses silver as an antibiotic. You can even use silver as an example on an external, on a burn. Nowadays there is actually a company that is making a silver, colloidal silver, not silver nitrate, a colloidal silver impregnated gauze for burns. And they are finding that using this colloidal silver impregnated gauze, no scarring even on 3rd-degree burns. There is this proliferation of the use of colloidal silver, so we have to be a little more careful by making good colloidal silver because the FDA is getting a little bit more and more involved. You want to make sure that there's no claims. We're not saying and making a claim that if you drink colloidal silver that you will cure your disease. Understand that. What you're using is colloidal silver is a micronutrient. You're using it to help empower yourself to promote health. And it's just another piece of the pie, another piece of the protocol that you're using to promote your own health. So very important to understand that ionic colloidal silver is a nutrient. Any questions on this unit?
I've been told to purchase colloidal silver at a store can be quite expensive. So is it difficult to make my own colloidal silver?
Good question. First of all, colloidal silver is very expensive. You're talking anywhere from a 4-ounce bottle. I've seen it anywhere from $19 to $40. You'll also see a variation of parts per million. Some people are saying it's 5 parts per million, 20 parts per million. You'll see some on the market 500 parts per million. So there's a variation. You go into a health food store today, you might see 15 different brands all selling colloidal silver. Which one is good, which one is not good? Yes, you can purchase colloidal silver, and if you know the company and you know how their colloidal silver is being made, good, but you will pay the price. We make our own colloidal silver, and we make it in about a 16-ounce beaker, a Pyrex beaker, and you now have a good, everybody in all the members of my family can drink 2 to 4 ounces at a time. And you drink so much colloidal silver daily. Again, you're using it as a nutrient, as nature's antibiotic. So it's part of the prevention. Once your symptoms are gone, you want to use colloidal silver for prevention.
Does colloidal silver solution have any particular taste?
It should have maybe a slight metallic taste. It's almost very similar when someone tastes zinc. As an example, if someone is deficient in the mineral zinc and you give them a zinc tally test and they put the water with the high concentrations of zinc in it, you won't taste any of the metallic taste of zinc at all. If you have zinc in your body and you're not deficient in zinc, when you taste it, it'll taste very metallic. This may be the case in silver. If you're very deficient in silver, no matter what concentration you're drinking it at, it may taste like water. And that's going to give you that signal that you probably need silver in your system. Once you're drinking silver over a good period of time, and that same concentration that you've been cooking it, and now it's starting to taste more and more metallic, that might tell you that you finally have saturated your system with the amount of colloidal silver, in which case you may be able to lower the dosage amount of how much colloidal silver you're taking. I know that myself as a health practitioner, if it's the flu season that's going around and everybody that's coming in is sick with fevers and flus, I'll drink 10, 15, I'll drink 16 ounces a day. I'll drink 4 ounces 4 times a day. Now, if I was to open up a bottle that cost me $35 and drink that 4 ounces 4 times a day, I'd have to be independently wealthy. So, well, that wouldn't be such a bad idea either. But at least at this point, I'm making my own colloidal silver so that I can drink the amounts that are appropriate for what the intent is that I want to do. Again, if I have a disease process that I'm attempting to eradicate, or am I just practicing preventive medicine? Now, once your symptoms are gone and you're now practicing preventive medicine, a little couple ounces of colloidal silver a day, I think, is more than adequate.
Yes, I just have a couple of questions. Why is the particle side, or the parts per million, so significant?
They have found that above 18 parts per million, there is no change in the rate in which it kills the bacteria. There is a slight change in the speed at which it kills the bacteria. So instead of 15 minutes, it did it in 8 minutes or in 3 minutes. But again, you're talking overkill. Do you need an atomic bomb to maybe just knock out a little infection? So what we're talking about is really, I would say that you would never want to cook it longer to get what we would consider 20 parts per million. I do not think that that's necessary to go over. And most of the time, you're really talking about 5 to maybe 6 parts per million. The normal person, 3 to 5 parts per million is totally adequate for most of our uses. Again, if someone's symptoms, if they're attempting to really alleviate a specific symptom or an infection, they might choose to do a higher parts per million. But once again, that you're in this preventive medicine and you're healthy and you're doing all of the things that promote health, 5 parts per million, a couple ounces a day is just a very good nutrient, nature's antibiotic again. More questions?
I understand there's 2 methods to make colloidal silver, one with salt and one without. What are the differences?
We have found that if you really want to use it for long periods of time, that distilled water is the way to go. When you use the salt, what happens? You're making silver chloride. Again, it's a compound. And when you have large compounds, and those compounds are larger molecular size, that's where the risk of the discoloring of the skin or the tissue may come in. When you're using pure distilled water with no other minerals or proteins or albumins or anything in that water, and you're using just the distilled water, you will get high-grade silver that will never cause any problems in discoloration of the skin.
What would be the life of a pair of silver wires?
Only one wire, the silver comes off one wire at a time when you're doing the electrolysis like this. And if you just switch each time you make the colloidal silver, you'll just switch the wires back and forth. This will extend the life greatly. And I'm finding that I make silver every day, and it's lasting well over a year. Now, if you want and you like new wires, that's certainly inexpensive enough to buy, but I think well over a year, if you're making silver every day for your whole family, that it's a very low expense.
Yes, what about the good bacteria in my gut? Now, colloidal silver being antibacterial, is that going to destroy the good stuff as well as the bad?
Well, there is some research that say that may, and there's also some that shows that maybe it does not get destroyed, that the good bacteria uses the colloidal silver in the same way that our white blood cells in our body uses it. So we're not sure. I think a lot more research needs to be done on that. My suggestion is a probiotic is a good thing to take anyway as a daily supplement. Nobody's making their own yogurt anymore. Nobody makes their own pickles. Nobody makes their own sauerkraut. Nobody makes their own cheeses anymore. So this is where we used to get these probiotics. And again, a probiotic is the good bacteria. An antibiotic, which you get from a physician to kill bacteria, is indiscriminate. I don't believe the silver is as indiscriminate, but yet to be on the safe side, always take a probiotic.
Yes, you'd mentioned earlier about the colloidal silver having the ability to sterilize water. Can you talk a little bit more about that?
Yes, actually, silver is nature's antibiotic and will actually sterilize or deactivate, kill any known bacteria, anaerobic bacteria. I mean, E. coli and Pseudomonas and all of these different types of very strong bacteria, the silver has been used.
I have given my children colloidal silver, and always with really good results. But my question is, how much would I give them, just to see if I'm giving them the right amount? And is it safe to give them colloidal silver?
Now, that's a very good question, especially for children. One of the things, if you're making the colloidal silver properly so that the particle size is small, now again, in the demonstration we'll go over that. The side effects of the proper kind of silver are none. The side effects for the wrong kind of silver can cause the ageria and discoloration of the skin, or it might have a taste that the kids certainly don't like. But if you make silver properly, there should be no side effect. Now, how much to use? Again, you as the parent have to make that decision. There are no rules and regulations from the FDA or anybody else telling you how to use colloidal silver. So Are you using it disease-specific, symptom-specific, or are you using it as part of a preventive medicine as a nature's natural antibiotic nutrient? If you're using it as a nutrient, 1 or 2 ounces a day is plenty for a child. If they're sick and you think that they might be getting the flu, certainly there's no harm with 3 or 4 ounces a couple, 2 or even 3 times a day. So again, use your own judgment, and it's based on the natural principles. We're not going after a specific symptom. We're going after promoting health. But when you're using it to alleviate a cold or a flu, okay, you can increase the dosage a little bit. Hi, and welcome back again. We're going to demonstrate how to do the ionic colloidal silver. Now, just before I use the machine that's been endorsed by Dr. Bob Beck, let me show you a couple of home units. This is one with a 9-volt battery. You can see the light works when I touch the wires together. A little bit of a corrosion on the wire, but you can see it's certainly adequate. It will work. Because of the 9-volt battery, it may take a little bit while longer to get that 3 to 5 parts per million. The other unit, you can see the silver wire has been attached to alligator clips, easily goes into the water, and you'll be able to use it. Again, another machine. They are adequate. You can get the specs for the machines from Sharing Health on the web and make your own. But again, I really like the unit that's been endorsed by Dr. Bob Beck. You can see I have the water boiling, and it's almost boiled, not quite. It may be ready by the time we put it together. Brown bottle. This is so that you can store your silver. Silver does react with light. It's just like a silver on a Polaroid camera. The film has silver in it. So what you want to do is store all your excess silver in a brown or even these new purple bottles, but it's got to be a dark bottle. So here we are, we're ready. We have the silver wire, and you can see I have it marked with a little red mark. That's just for the ease of the demonstration. And what I usually do is take the emery that comes with it, and I want to clean the wire first very quickly, just a few swipes of the wire, and to get all the oxides, the silver oxides off. And I have the unit, and you can see it's a simple unit. Undo the wires. Now here's the little clip, and you just move the clip out of the way. You can also see here's the little holes for the wire. Our water's almost ready. We take and we put the wire into the little hole. You can see I just move the clip out of the way, and the wire comes in, letting go of the clip, and the wire stays. Same thing here. I'm going to put it in. And again, you can see I move the clip. Here it is. Now, our water is boiling. You want to be careful. Very important. This is on the hot plate. These are safety devices so that the glass won't break. I just want to show you to make sure you use that. Here's our Pyrex container. It's on a piece of cork because it is hot. You can also get a little coffee warmer that you can get at any office supply, so that this, the things that sit on your office and your desk to keep your coffee or tea warm. And you put this right on that before you fill the water. This way it'll keep it hot the entire time. So very simply, we're going to turn our hot plate off, and again, if you use the stove or whatever, and just to be careful, we're going to pour the water in, and again, we have 2 cups of water. Very important, by the way, again, is the purity of the wire. What we have here is 99.99% pure wire. So here you can see we have the unit made by a manufacturer. It's plugged in to a wall unit so that you can save the batteries. You then plug in the unit, and you can see that it's working. You can also take it out, and if you touch the wires together, you'll get that little red light that comes on that says that it's a short. So we know the unit is working. We put it into the water. and we let the unit sit and do its work. Now, every 3 to 4 minutes, you want to stir the wire. You want to use pure distilled water, not deionized water, but pure distilled water. Now, one of the things you saw that we boiled the water. The reason we boiled the water is for particle size. The hot water will conduct electricity better, and we will get a small uniform particle size. Now, again, every 3 or 4 minutes, I stir it a little bit, and if I see some of the black particles coming from oxidation, very simple, and you just clean it again very lightly, put it back into the water. Now, you notice that the wire is about 75% into the water, and that's a proper coverage. Approximately 20 minutes is the average amount of time to cook. You'll see that it'll probably stay clear. Again, if you taste it, it's a slight metallic taste. Some people cook it for 30 minutes or even 40 minutes, and they want that slight yellow tint to it. Now, if you see the gray, it means, again, impurities. And again, each time you use the unit, because the wires are individual and can be exchanged, one wire for the other, this way it'll allow your wire, when you rotate it like this, to actually double the length of time of your wire. But this is the unit. You can see how easily it is utilized, and this is, again, the next part of the 4-part Bob Beck Protocol. The next part of the protocols that we're going to talk about is the ozonation of water and drinking ozonated water. Ozone has to be one of the most misunderstood elements in the entire world. There is more disinformation about ozone than anywhere. You've all heard of ozone. You get the ozone reports from Los Angeles or Mexico City or Hong Kong where the smog is in the air and you hear about ozone. Well, let me explain a little about what ozone is. Ozone is O1, O3, O4, O5. It's called singlet oxygen. We breathe O2. But up in the atmosphere, when oxygen is hit by radiation from the sun, it produces O3, O4, O5, and they've actually measured all the way up to O19. Now, that's a very unstable molecule. The O19 will break down to O18, leaving an O1. But let's go all the way down to O4, O3, because this machine produces O3. The O3 will break down, leaving O2 and an O1. It is the O1 that we use as ozone for the body. And actually, ozone inside the human body, or oxygen, this singlet oxygen, is what white blood cells use to kill bacteria. Actually, macrophages can surround a bacteria. They open up a little valve called a peroxome, and they squirt hydrogen peroxide onto the bacteria or pathogen microbe. What is hydrogen peroxide? H2O2. That immediately breaks down to H2O, leaving this O1. And the O1 is what deactivates or actually kills microbes. Now, again, the body will produce catalase and peroxidase to stop the free radical damage from this singlet oxygen. Now, you've heard of this free radical damage, this singlet oxygen that they talk about, free radicals. And what it is, again, it's a chemical. This oxygen is minus an electron. It's looking for this electron. So what happens is that because it's so unstable, it will try and find something that has this extra electron. And that's usually pathogens, bacteria and viruses and microbes. Now, there's a lot of research in Europe using ozone. There's an extensive amount of research. Germany specifically has been using ozone for many, many years in the disease process using the medical model. Now, a lot of people think in the United States that ozone is not being used. Almost every top operating room in every top medical hospital has ozone in the deactivating or killing pathogens in the air. It keeps the operating room sterile. Almost every top operating room in the world uses ozone in the operating room. Almost every single water processing plant that makes bottled water will use ozone to make sure that the water is pure. Understand the body uses free radicals, or this singlet oxygen, to actually deactivate or kill disease. Now, there are places around the world that are doing phenomenal research. Cuba is one of them. Germany is another one, again, doing a lot of research. Now, people talk about, well, ozone, don't breathe the ozone. Again, what is ozone doing? Ozone actually deactivates every known negative compound that exists in the world. So up in space, up in the atmosphere, what ozone is doing is deactivating all the hydrocarbons. When you breathe ozone and people say, oh, it's going to irritate your lungs, what we found is no. What it does is it deactivates the hydrocarbons in the lungs. We all breathe anywhere. Most of the time there's smog. Where this original research came from about not breathing ozone, as an example, came from mice. And they put a huge amount of ozone into the air, and they found that within the first 3 days there was a pulmonary edema, fluid built up in the lungs. But then what they didn't report is that after those 3 days, the lungs returned to normal, and no matter how much ozone they put into the container, where the mice were, they could not induce death into the mice whatsoever. So what the ozone does is it will clean out chemicals that are in your lungs, and that's what happens when you breathe it. Now, it does cause an irritation, so I suggest not breathing ozone. Okay, but by ozonating the water, what you're doing is putting that in, and by drinking the water, you're getting that direct delivery system of the ozone right into the bloodstream through the stomach and the intestines. So it'll go to the liver through the portal vein and help the liver. It'll go into the bloodstream and oxygenate, and what you're actually doing is giving this singlet oxygen to the body so that white blood cells can do their job. Now remember, make sure you're taking your antioxidants, eating healthy, and if you're going to be ozonating water to promote your health, then stop all the negative things that take away or promote disease.
Yes, I have a question. Just getting back to actually breathing in ozone. So if you were going to be using this particular water ozonator, how would you avoid breathing in that particular ozone?
Now, one of the unique things about this unit is it puts out a low enough dosage of ozone that it does not exceed the government standard. So it's not going to put enough concentration of ozone into the atmosphere where you are in the ambient air or anything like that, where you're breathing it to cause that kind of irritation. But again, if you were holding the hose right next to your mouth and inhaling it, yes, that's going to cause an irritation. Don't do that. Use common sense on this again. That's one of the important things about natural health care. You're doing your own research. It's an experimental process, so use it wisely. Another thing to understand about this unit is when you're using ozonated water, what you're doing is sterilizing the water. You are actually deactivating, killing bacteria. You are actually killing the bacteria and deactivating microbes and funguses and yeasts and viruses. So you're actually sterilizing. Now, a water purification system is a filtration. You're actually filtering out the water. Very different process. So yes, it's important to drink filtered water in your daily life, yet ozonating, and especially cold water. Now, the colder the water, the more ozone that it actually holds. So you want to get a really nice, chilled, cold water, clean spring water. Make sure that it's not tap water, and you will really have the benefits of a highly ozonated water. And when you drink it, two things can occur. One is that you might feel sometimes energized and just like raring to go. You feel a little energetic. So again, be careful. Use it as part of a whole protocol. And again, if you're eating healthy and exercising and doing all this, you will only notice the benefits. Any other questions?
Yes, doctor. I've heard that there's a couple of different methods for generating ozone. I have two questions, actually. The first one, what particular type does this unit do? And secondly, if I want to save some money and try to construct my own unit, is it difficult to do?
Again, both good questions. There are two ways of developing ozone. One is with an ultraviolet light, and just like ultraviolet rays from the sun and the cosmic rays from the atmosphere from the sun bombards the oxygen, and that's how you get ozone. The other way is called a cold corona generator. The cold corona produces a very high quality output of ozone, quite a bit more than the ultraviolet production. So this unit is cold corona. The second part of your question, which is can you build your own unit? My suggestion, don't build your own unit. We have equipment now that is endorsed by Dr. Beck that is inexpensive, and when you're starting to work with ozone, that's a chemical that you have to be careful. It's very corrosive, and it can cause damage. And if you're using an ozone machine, trying to make one as an example, and you don't use the right tubing or the metals, ozone can cause damage when it's not used properly. The body, and the same as the earth, uses ozone to detoxify. How the planet uses it is an example with the ozone in the atmosphere that goes into the rain, and rain is very high in hydrogen peroxide. Hydrogen peroxide again is H2O2, and it rains, it goes in, the hydrogen peroxide turns into H2O, leaving that O1, which detoxifies the planet, the atmosphere, the soil, the waters, the streams and rivers. So in taking ozone internally, it also detoxifies. But if you were to make your own unit using the wrong kinds of equipment, you would put into your body definite chemicals from that corrosive nature of the ozone, so I don't suggest it. Other questions?
Yes, I have a couple of questions. I've heard that oxides of nitrogen are produced when using the cold corona method. Is that correct?
When you're ozonating water, it's negligible. It actually is a non-issue. Now, for other uses of ozone, such as bagging or rectal insufflation or even autohemolation, now you're talking medical grade oxygen bottles and a medical grade ozonator. But for ozonating water, it's a non-issue.
Okay, thank you. Are there any other uses for this particular unit other than water ozonation?
Yes, first, regular ozone has a lot of other uses. It's, again, used to ozonate water for detoxification of the water. You can ozonate olive oil and make a paste where the olive oil has a lot of ozone in it. And you can use it on cuts and bruises and even skin cancers, things like that. There's also ozonating or for deodorizing air. So if there's a severe odor in something and you wanted to get that odor away, that's what ozone is used for. Now for this particular unit, you really want to ozonate water, but there's a lot of kinds of water that you can ozonate. Let's say you're soaking and cleaning a chicken, or you've got a piece of meat and you just want to clean it off. Well, you either ozonate the water or have some ozonated water and just rinse your meat or chicken in that ozonated water. You can also make sure that you have enough ozonated water to put your vegetables in. Remember, ozone will kill any pathogen, any kind of virus, bacteria. So it's used to detoxify, to kill pathogens, whether it's in odors or on a food. Let's say you have some dirty shoes and smelly socks in the closet, and you can go take the unit and just let it run in the closet while you're not using it, and let it run 24 hours. It certainly will help to deodorize any smells. But the main thing that the unit is used for is to ozonate water, to drink. That's the protocol for the Bob Beck, the part of the 4 protocols that we're using. Remember, we're looking at electrification of the blood, magnetic pulse generating, making colloidal silver and drinking it, and drinking ozonated water. This entire protocol process is to restore health.
Well, I was just going to make a comment on that. One other thing that I've used, I mean, it's drinking the ozone water, but one thing that I use it for particularly is when I'm feeling upset stomach or nauseated, I just drink a glass of ozone water and it makes me feel so much better. It just alleviates the nausea, and it works just really great.
Great.
And that's correct. You know, drinking ozonated water, because it kills bacteria. We know someone with ulcers, as an example, or someone with these severe heartburn and ulcerous condition, they may be contaminated with the HP pylori or Helicobacter pylori bacteria. We now know that's the bacteria that causes ulcer. So drinking ozonated water may actually kill that bacteria and settle an empty stomach. One thing that we may have to be a little bit careful of is I wouldn't drink the ozonated water with your meal, because it may deactivate some of the enzymes for digestion. Drink your ozonated water in between meals, an hour before. Now, I suggest for everyone, one of the things that most people don't know is that you have to have a bath of water for the food to be in your stomach, to be digested. So you want to drink a good glass of water maybe 30 to 45 minutes before you eat a meal. This will then prepare the digestion. The ozone will actually absorb right into the bloodstream, and by the time you eat your food, you have a nice bath of water, so that when you chew your food, that food will go into this bath so that it can be dissolved. Water is a universal solvent, so it'll dissolve almost everything. And most people don't realize when you eat food without the water in your stomach, it stays in this thick mass like clay. You will then have to draw fluids from all over your body, and that's where you have all this digestive upset. So drink the ozonated water a good 45 minutes before you eat a meal. Good question. Other questions?
You mentioned cold water for ozonating, but would there be any benefits to, say, ozonating a bathtub that I would bath in?
Now, that's a good question. We know that hot water will not really uptake. It will not really hold ozone. That's why we use the colder the water, the more the ozone. Actually, if you take very cold water and then freeze it, that ozone will stay in the ice cube until it's melted. But hot water, very little ozone will go in. I think there would be very little benefit in using it for a bathtub. Now, there are some medical grade ozone units that are done in steam units. Very expensive. You may pay $3,000 for one of those units that you sit in a steam container and it produces ozone into that steam. But again, you're talking a medical grade high output ozone generator. What we're talking about is something the average person, middle America, someone taking an active role in their health care, can use without harm, without worry, in their own home, and use it with their children and their entire family, and not have to worry about are they going to do something harmful because there's too much ozone. Again, very good question.
You mentioned children, and I have 3 children of my own, and I mentioned earlier about drinking ozonated water for nausea. Until I discovered the ozone water, that was the #1 problem with my kids. Mom, I have an upset stomach, and I never knew what to give them. And I always had this problem. I'm sorry, you know, like, here, have a Tums or something. And now I give them a glass of ozone water, and it solves the problem. Like, it's probably the #1 best thing that I've found for my kids.
And that's excellent. And I would say that one of the biggest things with children, they don't drink water. And a lot of times this upset stomach is because they eat and they didn't drink enough water. They don't drink water throughout the day. They may drink soda pops and Kool-Aids, and not liquid. It's not water. When we talk about water, we're saying water. coffee and soda are both diuretics, as an example, so you have a net loss of water. So I tell, for every cup of coffee you drink, you better drink another 10, 15 ounces of water. For every soda pop, another 10, 15 ounces of water. Alcohol, another 10, 15 ounces of water. But most children just don't seem to drink water. So it's really important to get them into a habit that very young in life to drink water. And again, it's critical when you drink water. So one of the things that I teach my clients, especially the children, when they have these little upset stomachs and they just don't feel well or they're really congested, I tell them, drink that first glass of water when you first wake up in the morning. Then make sure that you're always drinking a glass 30 to 45 minutes before a meal. Don't drink any cold liquid with the meal. Usually room temp would be okay, or a little hotter than room temperature. And then make sure you drink a nice big glass about 2 hours after the meal. Now, why we don't drink the cold water with the meal is because the digestion takes place at about 104 degrees in the stomach. You drink an ice cold glass of water with the meal, the digestion goes down, the enzyme reactions slow down, you don't digest your food as well. So it's important. Drinking water is probably one of the single most critical things for promoting health. And drinking ozonated water would be an additional benefit to just drinking water itself.
Yes, doctor. When drinking ozonated water, could I expect any flu-like symptoms?
Remember we talked before in the other protocol with the electrification of the blood about this Herxheimer reaction, this die-off, and that's actually the medical term that's used for the healing crisis, the cleansing reaction, the detox phase that most people in natural health care have heard at one time or another. One of the benefits of drinking ozonated water is that it actually cuts that reaction. Remember, the Herxheimer reaction is to get rid of these microbes and bacteria and fungus and yeasts, things that we're attempting to clean our body out. Well, ozone helps in that process. It helps in two ways. One, it's a detoxifier. It actually kills those organisms. But also, which we really haven't covered, is that it's oxygenator. You're getting a supersaturated oxygen water. You're drinking that supersaturated oxygen water. That oxygen is absorbed directly into the bloodstream through the mucous membranes in your stomach and through the intestine. Some of that oxygen is going through the portal vein directly to the liver. Some is going directly into your capillary system and throughout the entire body. So you're actually getting a higher concentration of oxygen. Now, this has been tested in a pulse oximeter that medical doctors use, where you put it on your finger and you can actually measure the amount of dissolved oxygen in the bloodstream. And remember, we are oxygen beings and we are electrical beings. So we want to use both the electricity from the microcurrents and the oxygen from the ozone, and that's going to help restore health. Again, not to do a specific disease, it's to promote health. And how can you not promote health with more oxygen?
Excuse me, you mentioned earlier that they're using ozone medically in Europe. Now, is that to actually cure specific diseases?
Absolutely. There's research now in Cuba. Cuba is one of the leading proponents of using ozone, and they're doing for HIV. And they actually take a medical grade ozone with a medical green bottle of oxygen, and they will get it into the blood directly. There's what's called autohemolation, which you can, one of the machines, one of the best in the world, was by Basil Wainwright, which was like a dialysis machine hooked directly to the ozone. The blood would come out of the body, go through an ozonator, so that you're ozonating a total volume of blood, and then they would put the blood back into the body. In Germany and Europe, throughout Europe, they're also doing what's called rectal insufflation or vaginal insufflation or autohemolation, where they'll fill a syringe with maybe 30 cc's of ozone and then very slowly inject that ozone into the bloodstream. There's also bagging of ozone that can be done. There's many different ways of using ozone, but when you're talking about these higher saturations and using medical and syringes and all of these other things, you really want to do that under the care of a health professional and someone that's trained in the use of ozone. But ozone is, I think, one of the greatest boons to mankind. More important, to have a small unit at home where you can take an active role in your own health care. Why wait until you have a disease and you have to go to a doctor and spend $10,000, $20,000, $50,000 to get the ozone treatments, maybe $400 or $500 a treatment, or you have to buy ozone equipment that can be so expensive. To buy a bagging ozone machine for bagging, you may spend $2,000, $3,000, $4,000. So Bob Beck has given us the ability to use these 4 protocols with these 3 machines to actually promote our own health at home. Once those symptoms are eliminated, you then have the ability to practice true preventive medicine.
Yes, alleges. I was wondering if I'm likely to feel a difference once I've ingested ozonated water.
Actually, yes, there is. You may find that you're having great bowel movements, that you're peeing real well, that all of a sudden, if you've never sweated before, all of a sudden your body starts to sweat again, that all metabolic processes are improved. So if you've been suffering a lot of constipation or other kinds of where the elimination systems are not working to optimum, you may feel that. You might even feel energized. It's oxygen that you're using, so you will usually feel energized. And often, I suggest to my clients, when they are doing these protocols that starts to flush toxins out of the body, by drinking more ozonated water, you're actually alleviating those symptoms even more. That more than not, you're alleviating the Herxheimer reaction. Hi, and welcome back for the next part of the 4-part Bob Beck Protocol using the water ozonator. Now, it's important to understand that this unit, the one endorsed by Dr. Bob Beck, is made with all medical grade parts that are non-corrosive, non-reactive to ozone. And this is critical. I can't stress this enough. You'll also see here that this is silicone tubing. If this was regular plastic tubing, you would see that it would dissipate and actually melt in a matter of seconds. The machine itself is air-fed. It's using ambient air, so that means this is not to be used for other purposes other than making ozonated water. It has a cold corona, it has an air pump built in, and it is a 12-volt unit. Now, 12 volt is unique because you can use it for your RV or your camper. Have you ever been camping and you want to drink the river water and you're not sure that it's clean and sterilized? Well, then this will do that. We also have a medical grade ceramic diffuser and a Kynar hose attachment. All of this is non-reactive to ozone, and that is critical. You can see we'll put the diffuser in and you'll see the bubbles of the ozone coming out. Notice that I'm blowing with my hand. I'm kind of waving the ozone to me. You don't really just want to smell, but it has a very distinct odor to it. Ozone is phenomenal. It smells like you've been just outside of a storm, a thunderstorm or lightning storm. It has that same clean, really refreshing smell. Now, the temperature of the water, ice cold, the colder the water, the more ozone that it will actually store. Now, here I'm showing you, because ozone water only lasts about 20 minutes, so if you're going to not drink it right away, you want to store it with a top on, and I suggest storing it in a cold container. Now, very important, you'll see that we're making this in glass, and we're storing it in glass. Ozone is extremely corrosive. So what you have to be careful of is if you're using plastic, ozone will eat the plastic and go into the water. You do not want to do that. So here we have our ozonated water. We've been doing it for 3 or 4 minutes. We'll turn it off, take it out, And cheers. Refreshing. Again, the last part of the 4-part Bob Beck Protocol. These protocols are here to help you induce your own health, to bring back a state of health. Remember, health is a process as disease is a process. I want to thank you all for being here and asking such good questions about the Bob Beck protocols. And I just want to summarize a little bit. We have the 4 parts to the Bob Beck protocol with 3 different machines. Remember, we're talking about natural health care. So we're talking about those beginning processes. I said you really want to deal with your negative emotions. You want to deal with the fears and anxieties and depressions. These are all important, and you have to learn to process your negative emotions. And that's part of the immune system building. So this is, again, another part of our health building process. So the importance of lifestyle changes cannot be stressed enough. What we are looking at is learning to be able to take your own knowledge, your own intent, your own desires, and promote your own personal growth, your own personal wellness protocols. Understand that in natural health care, and this is one of the biggest differences between natural health care and allopathic health care, is we believe first and foremost that there's this innate ability inside all of us, and we believe it might even be this electrical innate ability within us to heal all diseases. So it's important to understand those differences in concepts. Allopathic medicine is dealing with getting rid of a symptom. Natural health care, learning to health yourself, as I call it, is taking your own active control to promote health, not to avoid disease. And one of the things that we have to look at is that as we grow and as we age, and so many people are concerned with death, as an example, that they're so concerned with death that they never live properly. And the same way with diseases. So many people are concerned with avoiding disease that they stop promoting health. It's the lifestyle changes that you make, the nutritional supplements that everyone needs to be taking, and take good natural supplements. Exercise, some kind of exercise, aerobic exercise and resistance exercise. I think it's mandatory, especially if you're getting older. The older you are, the more weightlifting or resistance exercises becomes important. And again, doing something of social service. I think that's very important, to be of benefit for your community, the community of your family, the community outside of your family, and your own personal community internally, helping all of the metabolic processes that occur. It's a wonderful experience, this journey of life. And it's also a wonderful experience when you take an active role to promote your own health. Again, thank you for having me, and thank you for joining us.
Yes, alleges, I was wondering, am I likely to feel a difference once I've ingested the water ozonator itself, or perhaps even a glass of water?
That unit goes down pretty rough.
I think as the cord goes down.
Uncomfortable. Okay, do that one again.
You'll splice this in somewhere. Okay. Okay. I can just, it's like...
Okay, right, do that again.
Other questions? I'm glad you're going to be able to do all this, taking, you know, the editor part, you know.
Jen's gonna throw popcorn at you.
How well and how I don't like that. Back up. Okay. I have to do that. Just do that in your brain. Oh, okay. Okay.
Wow.
It's not my turn yet.
But braces, it's probably, if it's made out of metal, iron, you know, if it's got iron, you know, you might feel your head go, you know. You know. I want to say that. Sure. No, that's fine.
Get comfortable.
Oops, I'm still rolling.
Okay, do that one again.
You don't get your mom when she's closer, do you?
Nope.
Yeah.
Paris is just interjecting one.
I didn't know that was there.
It's amazing that you've got a gel.
Yeah, take some candid shots.
No powder. I think the way to, as I was saying earlier, the way to make sure you keep it meaningful for yourself.
Do you know what I want to do? If I can do my question, because he's touched the
Another way of
chords.
testing, wait a minute.
Oh, I thought you stopped.
Another way of testing the unit. Should we wait for the train? That's going to go on. There's no way.
Yeah, I actually have a comment. I had an experience once. Well, I had my my unit on. Oh, I got to do that again.
Okay, do that one again.
Yes, it is correct. Yet when you're ozonating water, that's negligible.
Negligible. Say it 3 times.
Negligible. How do you say that? Okay. Okay, that's good.
Don't go there.
Absolutely. My wife, are you kidding? Without her, I'd be dead. 21 years we're still together, so, okay.